It is my great honor and pleasure to welcome you all to this 64th edition. A happy Dashera and Durga Puja to all of you. We have a stalwart in our field. So let Pawan, next slide please. Chairman of the program is Professor Dr. Tufan Pati sir. Sir, over to you. I'm not reading your CV. Apologies.
Thank you, Alim. So next slide, please, Pavan. We have got Dr. Amrit Pat Joshi and Dr. Alim Siddiqui are moderators, and both are vibrant, and you know both of them. They're quite regular in this. May I have the next slide, please? Dr. Ramanan Erat, who is a consultant psychiatrist in Palakkad and is a past vice president of Indian Medical Association Kerala State Branch and past president of Indian Psychiatric Society Kerala State Branch. He had been our chief election officer in Indian Psychiatric Society and very much eminent during that period and adeptly managed his task. And he is currently president-elect of IPS South General Branch. Welcome, Dr. Raj. Welcome. And we have got the other chairperson, Dr. Parag Shah. Next slide, please. He is from Surat. He is MD DNB and currently pursuing his PhD. Very much dynamic. Current examination professor and HOD of psychiatry in Nimar Medical College, Surat. Years of PG teacher and National Medical Council assessor 10 years. Number of publications 20. Positions held in organization ex-president IPS Gujarat State Branch. Journal representative of IPS Indian Psychiatric Society Western Branch. EC member Indian Psychiatric Society South Gujarat Branch. Areas of interest: tobacco cessation, digital and social media, screen addiction, professional skills development in doctors, any other special achievements, book publication, a manual on poor school performance for parents, teachers, and health professionals, communication skills for mental disorders. He is also very much active in community psychiatry. With this, I sincerely welcome the Lions of Indian Psychiatry, Dr. Erat and Dr. Parag, and hand over the further proceedings to the chairpersons of this meeting.
Thank you so much. May I request Dr. Erat to introduce the topic for today's session?
Thank you, Dr. Tufan and Dr. Alim and Amrit Panjoshi for asking me to chair this particular session. This topic, Gestalt therapy, was initially developed by Fritz Perls with the help of his wife, Laura Perls, and introduced in the 1940s as an alternative to more traditional psychoanalysis. Both Fritz and Laura were trained in psychoanalysis and Gestalt psychology. Gestalt therapy is a humanistic, holistic, person-oriented form of psychotherapy that is focused on person's present life and challenges rather than delving into the past experiences. This approach stresses the importance of understanding the context of a person's life and taking responsibility rather than placing blame. There are a number of principal ideas that come into play with Gestalt therapy, from perception to self-awareness. In this client-centered approach to therapy, Gestalt therapists understand that no one can fully be objective, and we are influenced by environment and our experiences. Rather than specifically targeting the past and asking clients to purposefully bring up old experiences, Gestalt therapists operate from a place of understanding that as clients become increasingly aware, they will overcome the existing roadblocks. Gestalt therapy can help clients with issues such as anxiety, depression, self-esteem, and relationship difficulties, etc. With this brief introduction, let us hear from Dr. Sam Manikam, who will speaking on accessing the hidden through the visible, experiencing ananda in Gestalt therapy. Over to Dr. Sam Manikam.
Thank you, sir. Before begin, may I take the privilege of introducing our speaker for the day. So it's my pleasure to introduce a thorough academician, a scholar, and a learned person we have with us today evening, Professor L. Sam S. Manikam from Bangalore. A lot of us know him for many years and have worked with him academically, clinically. For all those who may not be in contact with him, let me introduce him. He is currently the Director and Wellness and Mental Health Center at Bangalore, India. He has been the Professor of Clinical Psychology and a registered clinical psychologist certified in telemental health and digital ethics. He is formerly the Professor of Clinical Psychology at JSS Medical College, Mysuru. He obtained his Master's in Psychology from University of Kerala and did his MM and SP and clinical psychology training from NIMHANS, Bangalore, and his PhD from CP University, USA. He has been teaching in various places in India and abroad, counting some of them to be the Department of Psychiatry at CMC Vellore, CSI Medical College, Karakoram, as well as serving in the capacity of Professor and Head at the Department of Clinical Psychology at Sri Ramachandra University, Chennai. He has served as a visiting fellow at the University of Birmingham, UK, and he has underwent training in different forms of therapies and psychological approaches at various places and various countries like France, UK, Singapore. He has been a fellow of Indian Association of Clinical Psychologists, former General Secretary of Indian Association of Clinical Psychologists, and various other psychology associations in India and abroad. He is also a life associate member of IPS and is in the editorial board of IJP for more than a decade in different capacities. He is a fellow of Indian Association of Social Psychiatry, life member of Association of Industrial Psychiatry of India, and also the Association of Geriatric Mental Health. So we have a colleague, a senior, a teacher among us today evening to throw the light on a very interesting topic of Gestalt therapy. We welcome you, sir. On behalf of IPS, thank you for sharing your time and enlightening us with this topic today evening. We are looking forward for this interesting journey for the next 40 minutes, sir. Over to you. Thank you. Dr. Manikam, sir?
Yeah, I'm just trying to share my screen. Can you hear me?
Yes.
Yeah, good evening to all of you and namaste to all of you. Navaratri greetings at the beginning to all of you. And I'm aware that many of you would want to celebrate, be part of the celebrations, and you are here in front of the screen to attend this seminar. I welcome you personally. Before I thank for inviting me for this program, I would like to congratulate Dr. Topan Patti for starting this Thursday Musings, which has reached 68th edition now. And I think it's an honor for the Odisha branch, as well as I think on personal behalf, I would like to congratulate you from my bottom of my heart. And especially that's on psychotherapy. You have taken a lot of interest on that. So my appreciations to you, sir. I also would like to thank for inviting me for this program. I was surprised when Dr. Alim also called me. I see new faces like Dr. Ramanan Erat from Kerala and Dr. Parag Shah and Dr. Amrit Joshi who are all part of this organization. Thank you all. So without taking much time, I would probably start my deliberations. Whenever, though this is not exactly Gestalt, but when we can quote a lot of people from abroad, Freud or Fritz or all these people, this is one quote which I found has been very talks volumes because it comes from India, and that too from in the 8th century. A Buddhist, Shantideva, had stated this, and probably our psychiatry trainees who are interested in psychotherapy or helping need to be aware of this. So I thought that I will share this and I will read it for you. May I become at all times, both now and forever, a protector for those without protection, a guide for those who have lost their way, a ship for those with oceans to cross, a bridge for those with rivers to cross, a sanctuary for those in danger, a lamp for those who need light, a place of refuge for those needing shelter, and a servant to all those in need. It may not be fully echoing the spirit of Gestalt therapy, but I think this has got a lot of things to tell us. I think during the COVID times, this was really sort of giving a lot of internal support as I went on reflecting on this. So this is how I would like to have my presentation today. Just a brief introduction. I think our chairperson, Dr. Erat, has already given a Gestalt or a over bird's eye view of Gestalt, but I think still I'll present some of those things. Then I'll probably talk about my journey and some Gestalt therapy concepts which has not been touched upon. And I'm hoping to have a live dialogue, and an experimenting, which is learning Gestalt therapy or experiencing Gestalt therapy rather than talking about it. And I would also touch upon the Gestalt therapy and the concept of person from Taisiri Upanishad and the experience of Ananda. I may not go in this order. It might, I don't know what would emerge as I go on. This is one of the prayers which is often cited, which was written by Fritz Perls. I do my thing, you do your thing. I'm not in this world to live up to your expectations, and you are not in this world to live up to mine. You are you, and I am I. And if by chance we find each other, it's beautiful. If not, it can't be helped. This is what Fritz wrote long ago. But things are changing, and one of the stalwarts in Gestalt therapy who is living now, who is a 99-year-old Gestalt therapist, Erwin Polster, who had worked with Fritz Perls, would say that, if it can't be helped, then why do we need therapists? That's kind of a thing which is coming up. The first part looks very beautiful, but at the same time, we are rethinking whether it can be helped or it can be helped through the relational dialogue for which Gestalt therapy stands. As has been told, Gestalt is a German word which means whole or configuration, which means that the participants that we have here, I think more than 168, when they are together, it's not just adding 1 to 168, but when we are together, it makes a different kind of a configuration is formed. So that whole gives a different kind of a meaning for each one of us. So it looks very simple, but to understand it, it needs more of an experience. When we say that I make a contact with Dr. Alim, and when I make that contact, if it is when it is not one person, I can see him on the screen or Dr. Tovan Patti on the screen. So that what emerges in between us or what comes out of our meeting is something totally different. It is also conceived as an organismic need, which is described by the PhD. I'll talk about the PhD later. So, which means that it's not just a term, it's a need which is within the body, and the need comes up and it looks forward to formation of a Gestalt. And when that Gestalt is completed, the individual is free to move on to addressing newer needs, because there is more space which comes up for that person to move on. The core people has been already told by Dr. Erat, but people, though it was ascribed to Fritz, but a lot of historical Gestaltians would say that it was not just Fritz alone, Hefferlein and Paul Goodman, three people, they are referred to as PhD as forming the Gestalt therapy. They have worked on it, they have brought it out, but they have not defined what Gestalt therapy is. They have used Gestalt therapy, as you know, as has been told, they have moved away from the psychoanalysis and formed this or gave the ideas to come together to have this Gestalt therapy. And of course, Laura Pers is also credited. So though these three were there, my trainer has found out that, it was Laura Pers who had been instrumental in making Fritz right. And maybe it was her ideas that has been brought out, not Fritz. And Laura had also written about it. So all the women Gestalt therapists are very happy because, Laura is given the due credit for which she was sidelined when Fritz was alive. So that's one of the things. The four people has to be given credit. And as the therapy moved on, or the therapeutic literature went on, movement went on, there were more and more people coming to it. And probably it's said that if there are 10 Gestalt therapies, there may be 10 way of doing Gestalt therapy, not just one form of Gestalt therapy. And people add on, integrate different things to the theory of Gestalt therapy. I will not go into the details of the theories of Gestalt therapy, which would take time, but I may put some passing remarks on that. This is my trainer, Jerry Kogan and Willie, both of them I've met since. That itself is a long story, but Jerry is no more, Willie is still there. We are, they have been mentoring my process. Yeah. So one of the definitions that was formed as a shared worldview, which again comes from a Gestalt, German term, Weltanschauung, means a shared worldview. At a conference when people came together, this definition was formulated after discussion with different participants of the conference who have been practitioners of Gestalt therapy, which said that, is stated as Gestalt therapy is a process, psychotherapy. So the process is very important. With the goal of improving one's contact in community. That's also very important because it's very much relevant in our context and with the environment in general. So this goal is accomplished through aware, spontaneous, and authentic dialogue between client and therapist. Awareness of differences and similarities are encouraged, while interruptions to contact are explored in the present therapeutic relationship. Each of the terms of this definition would need more of description, but I will not go into that. As we go on, let's see what comes up. Yeah, this is Erwin Poster, whom I was talking about, and we have Margherita, who is from Italy. Erwin is from US. They've been modifying the not techniques, the therapeutic process in different ways. While Erwin talks about enchantment in Gestalt therapy, Margherita would talk about the aesthetic relationship or relational dance in Gestalt therapy and working with children, how that happens. Different things have been done by these two people. Erwin is 99 and he's still actively giving deliberations on Gestalt therapy. Yeah, so the basic thing is Gestalt theory considers organism and the environment in constant contact. So that is one of the things that we need to be aware of, that it is not seeing something isolated. The Gestalt therapy is in contact with the world. And if you are familiar with the Indian thought, there are a lot of things for one to relate to how the Indian thought has its own priority when we talk about the Gestalt theory as well as Gestalt therapy. And this relation, which we talk about in Gestalt therapy, is based on one's own capacity to be self-aware. If I'm not aware of myself, I may not be relating with other people around or in the environment. And I, as a therapist, needs to be curious and open to another's experience and viewpoint if I need to successfully or effectively engage in a dialogue. And I need to have skills to communicate effectively in order to influence with integrity. A lot of things are personal qualities of the therapist which comes into play. And of course, there are people like O'Leary who have integrated the person-centered concepts into the Gestalt therapy. So in Gestalt therapy, we look for direct and present experience and involved in the respectful dialogue. So rather than talking about stories or making people talk about stories, we ask the people to directly experience and be in the moment and see what comes up. And during that, the respectful dialogue happens. I think I will stop here with my presentation, and then I'll probably invite I think Isha is there. So I'm hoping that we can sort of have a dialogue with Isha and see what comes up based on what we have talked about. Hi, Isha.
Hello, sir. Good evening.
Hi. Good evening. Good evening, Isha. Yeah. I'm curious to know about you and your surroundings.
Sir, I am currently doing a master's in psychology from Nottingham Trent University. So it's closer to Birmingham, though.
Oh, okay.
And then for now, I'm
Yeah.
just back in India, being with the family.
Oh, okay. So you are at, what's your ground now? Where are you grounded now? In Birmingham?
So I'm still not in Nottingham, sir. I'm looking for a full-time job. So as soon as I get that, I would see where I have to relocate to.
So right now you're sitting in.
I am in Lucknow.
Lucknow.
Yeah.
Okay. That's interesting. Okay. Yeah. So Navratri must be very beautiful over there right now.
I guess it is.
Okay. Yeah, you guess it is. Okay. Nice to know that.
I haven't been out much, sir, so I'm not too sure if people are really enjoying right now, or if it's going to be a big festival out there. So I don't know.
Oh, okay. So what's happening right now, or is there something which you would like to bring up in our conversation?
So I believe right now what all I'm thinking about is how to go about getting my PhD or getting a job, for that matter, because I'm done with my master's. I'm supposed to graduate in this December. So as soon as that happens, I need a good direction in life as to, what do I do next, which is a big question.
Okay.
So I'm just trying to think about that, and I'm learning new things. So I'm getting new courses and everything. So I'm just doing that.
Okay. As you say this, what's happening in your body?
It's just so whenever I talk about getting direction in life, it just I breathe heavily. It starts from breathing heavily. It goes like I have a bit of headache at times. I'm not fully aware if that's just about because of the stress that I'm what I'm thinking or what I'm aiming at, or what I'm finding, or what I'm it just I have a bit of I would say like my whole body is tensed at times. And there's a slight pain just right behind my eye in here, I believe, which I'm slightly aware of whenever I'm talking about the direction.
Oh, okay.
So it just happens that
Okay. So you also said that your whole body is affected, and now it has come to the forehead. Is that what you mean? Oh, okay.
Yes, I believe. It just starts like jittering from all over, and then gets up till here. So I believe it's just as soon as you go in deeper into the conversation,
Can you
talking
say
about,
I instead of you? Can
yes,
you say I instead of you?
yes, sir. All right. So
Okay.
whenever I am thinking about the next step in my life, or the next degree, or the next job, or the next plan of action, I definitely have that kind of, it's just very different, and I feel very tensed at times, which is hard to notice. But when you just sit and introspect what is going on, it feels like you are just not, you
I
are
am
haven't
not.
accomplished anything.
I have not accomplished, not you. Can you
I
say
I
I have not
I have.
accomplished? Okay. I have not accomplished anything. Okay. Oh, okay. That must be making you feel a bit heavy.
At times, yes.
I noticed that you are keeping your hands on your chest. Is it? Are you feeling something over there? Or
I think this is just what I do whenever I have a conversation about, particularly about my next plan.
I see.
So I
What
tend,
is when you keep this? What is it saying, or what is it?
it's just, I believe as I said, I breathe very heavily. So there's a long sigh, not of relief.
Oh, okay. Can you breathe now easily and see what comes up for you? Take a deep breath and see. Deep breath and breathe out. Yeah.
I believe as soon as I distract my mind and not think particularly about my stressors, I think I'm okay then. Gradually, I'm going to be fine. But then as soon as I go back into the zone,
Okay.
it's going to be...
Be here right now, in Lucknow, in you, wherever you are, be there. Yeah.
So that's there.
Okay.
Mhm.
You are concerned about the direction. Is that what is coming up for you right now, or the back is coming up for you?
I believe due to whatever I've had in my past, it all shapes of what I assume my future to be like, which makes me a bit skeptical as to what has to happen, what will take place, and if at all what I believe what would happen will happen that way.
Okay. What are we experiencing right now? Not tomorrow, or what in the past?
A bit anxious.
Okay.
About the future.
Okay. Future is not yet come.
That is right, sir. But I believe
Yeah.
it's just I think the back of the mind, there are times when I just go back into that zone and start thinking about what if and what if and what if.
Okay. Yeah, I'm afraid we may not be able to take all that things right now, but what is it that is prominent among that past that you are talking about right now?
The most prominent thing would be
Can you put that as an object, or I don't want you to talk if it is uncomfortable. I don't want you to talk about it, or is it okay if you can put something in place of it, or?
Definitely, it's hard to put across an idea of what's happening now, because it's a feeling of being skeptical, a feeling of being I would say not being aware of what you want, or what I want to do, and
Given a chance, what would you like to do now?
get more information of
Oh, okay. Of, yeah.
get more information of what is supposed to be done step by step.
Okay, okay. Okay, that's an interesting thing. Okay. Is that something which you can do on your own, or you need support from others for that?
I've always believed that I can do everything all by myself if I'm given the right resources.
Okay, okay, okay. So you feel like a person without any resources, or?
Not particularly, I would say that. I definitely have resources.
Yeah.
I definitely do have a lot of resources. I just need to acknowledge and identify the opportunities, identify the resources right now in the right way, in the right manner.
Okay, okay. So the past doesn't come in place over there.
The past definitely does, but as I said, whenever I go back in the past, think what I did, I try to acknowledge what I have done and improvise on what I have not done. So I think I just do not look at my failures, but I still acknowledge them and try not to repeat them in further.
Okay. What kind of a failure comes to you right now when you think of the past?
Not planning enough.
Okay, okay. So would you like to plan it right now?
Definitely. Definitely.
Okay.
I would try my best to plan out a basic strategy of what I want to do and how I want to go about things.
What is it that comes up for you right now when you think of putting things in place, planning it in proper way right now?
When I think of planning my future, planning my next step,
Right now, yeah.
Right now,
yeah.
Would be applying to as many places I possibly can.
Okay. You have done that, or you are in the process of doing that?
I am in the process. I have definitely applied to a lot of places, not giving up, despite getting a lot of rejections and unfortunate emails in my inboxes. I believe still at it.
I like the way you are smiling at it and taking it. Yeah, that's nice. Yeah. What is it that's coming up for you right now?
Just one thing, sir, that my mom is always telling me, that if you have to do something, better do it with a smile than with the cringe. It'll make you strive forward. It'll make you go ahead and still be sane.
Oh, okay. What does that mean for you when she says that?
I guess she doesn't want me to panic and or think irrationally and take a wrong decision, take a wrong turn, which is definitely not benefiting me in future.
Okay, that's what you are saying about the direction that you're concerned about. Okay. Do you have lots of directions in front of you?
Lots of them, sir, but I really want to focus on just one right now.
Okay.
Which is
that's
challenging.
How is it for you when you just focus on one thing right now? Is there some object in front of you where you can keep in front of you to represent that direction?
Definitely, sir. This
Yeah.
is,
Okay.
if I just keep on looking at this, I will have,
Yeah.
and I focus on this, I'm
Okay.
sure that I would not be distracted and
Talk to
looking.
that right now. You talk to that right now.
I'm going to focus on you.
Mm-hmm.
And I think if you are standing right ahead of me, I don't think I can look at anything else.
Mm-hmm.
You are where I want to be.
Mm. Can you say I instead of you? Can you put that as I?
I'm going to be here.
Mm-hmm.
This direction is for me.
Yeah.
And I'm sure that I can avoid all the distractions as possible.
Mm-hmm.
And I will follow this direction towards my aim.
Oh, how does it feel for you right now?
A feeling of achievement, I guess.
Oh, okay, okay. So you feel, would you like to say that again? I feel
There's a sense of achievement
okay.
that I have right now.
Oh, okay. So how can you see, how is it for your, how do you feel within your body right now?
Definitely positive. All my stress and all, I guess the feeling of being tensed,
Mm-hmm.
I feel a bit relaxed.
Okay, okay, okay. Mm-hmm. Nice. Stay with that. Stay with that. Okay, nice to see that smile. Okay. Yeah. Thank you, Isha. Thank you for Isha. Yeah.
Thank you.
Would you like to say anything to the audience?
I feel it's always better if you talk things out.
Not you. You talk for yourself.
If
I
it
am
always
right now.
feels better. Yeah,
Right now, how you are feeling? Yeah.
it always feels better when I talk things out.
Mm-hmm.
When I'm not just keeping things in me. It creates a lot of imbalance when I'm not sharing it or when I'm not talking things out. But it gives me a lot of clarity when I just talk things out, when I just say, when I discuss.
Okay. Yeah. Thank you. Yeah.
Thank you.
Thanks for accepting my invitation and being here. I think I've also learned a lot working with you. Yeah. Thank you. Bye. Yeah. I think we can have some questions related to this during the question and answer session, but I would like to probably move further in my talk about the journey of reaching towards this. I was actually trying to explore certain things which had happened during the past couple of weeks. When Dr. Tofanpatti's call came to me, actually, I couldn't believe myself. I was wondering he would have got a wrong person for the call, but I just couldn't believe how can Dr. Tofanpatti in a far off place whom I have not seen could be reaching out to me. So then that is a kind of a contact that is being made, which again is essential in the form of Gestalt therapy, but it was not a therapeutic contact, but contact is very important in our day-to-day life. Now, when the call came, it actually brought in a lot of different kind of sensations within my body. That's what happens in, or from the Gestalt perspective. It's not just in the mind; it happens in the body. Different kinds of sensation would happen. Bit of nervousness, bit of is it going to be real? And not only that, it brings up a lot of other things which has happened in the past. That a lot of I think what you had seen here also referring to the past. Things which are unresolved, which is from a Gestalt terms we would call that as the unfinished business can come up, which can disturb the harmony of the dysregulate the people or person. It really did to me. So some of those things, when it comes to that's when I sort of started reflecting back about my journey. How did I come to this Gestalt therapy? What was the thing that took me to the Indian thought? So then I was reflecting, and I was I need to share that actually the patients is what they made me go back to learn different things, because I was practicing psychotherapy in Kerala. I went back to Kerala from Tamil Nadu, where people were speaking Tamil. I was not comfortable enough in understanding people and the dynamics, so I went back to Kerala. Then I found a lot of information. I'm able to understand them. And as I was trained in different forms of therapy, I was trying to see what kind of a therapy am I doing. Is it behavior therapy, or is it existential therapy, or is it cognitive therapy, or REBT, or different kinds of things? Then I found that it's not fitting anywhere. And it is not fitting into any of the theories that I learned. Then I thought that I need to probably look at a different orientation. And that's when I started discussing with different people, and I found that there's some concept in the Indian thought which might explain these things. So there, different people have helped me. One of them is Dr. Bellotti, who is Nomo, and we spent a lot of time. He was my teacher, but I mean, he had. I'm trying to share my screen again. Yeah. Yeah, this is Bellotti, who had probably gave me a lot of thoughts about. There were a couple of other people also from different disciplines who helped me to understand the Indian concept. And this is one of the things from Taittiriya Upanishad, which talks about the Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and the Anandamaya Kosha, which is there in the Taittiriya Upanishad, which I think many of us have forgotten or looked at the way it should have looked at. In this, probably we are focusing on different dimensions of it, which now people are talking about. It was not just the physical, just not the psychophysical, it is not just the psychological, it is not just the cognitive aspects or intellectual aspects, and it is the spiritual also. All these dimensions are coming back from the West, but this is something which is there in the Upanishads, which we have not looked at. And if you look at the literature, Girinder Shekhar Bose, many new entrants to psychiatry, I'm afraid, may not be aware of Dr. Bose, who was a medical doctor who has taken up psychology and become a sort of the first psychiatrist to give medication in Kolkata. So what is there in them, or what did they bring up? Dr. S.K. Ramachandra Rao also wrote about the Indian concept of these things which we talked about, the development of psychological thought in India, and this he had written very much about it. So this is something which we need to look at. What is its connection with Gestalt therapy? That's also very interesting, because when we talk about the Gestalt, in fact, during my training in Germany, I gave my cases to the trainers. They said that, oh, this is Gestalt. So probably Fritz also had taken Eastern concepts. Even now, there are several people, including Erwin Foster, has been talking about the Buddhistic concepts into Gestalt. So this is some basic idea or the concept of person which we need to address or take it seriously and explore it and see whether we can have a better approach in psychiatric care, not just Gestalt therapy. I think whether you follow a particular approach or not, I think this is very important in looking at or helping us people. We need to understand the larger field. When we talk about the Gestalt therapy, it's not done just in isolation. If you look at what I was trying to do, there was trying to see what's the background or the grounding that the person has, what is the field in which one person is there. So that's all the more important in understanding it. Especially in India, we have a lot of challenges within the field, which unlike the classical field theory, which talks about just the field and the figure, there are a lot of pulls within the field, which I'm discussing with my other people from different parts of the world about how do we explain or how do we address these different pulls within the field, which can pull down a person, which most of the Indian clients, especially adolescents, younger people, the pulls from the family, pulls from the community, pulls from the society, different things should come up, how to handle that. But is it the bliss or the aha experience that one feels in Gestalt therapy? Is it something just the economically related one, or is it something which is beyond? And in fact, a couple of weeks ago, I've been conducting different training programs and on Gestalt therapy. A couple of students were asking, what is it, once you work through and come to an aha experience, as it is told in Gestalt therapy, what is it, what is this kind of an experience? So actually, it's very difficult to explain in sort of words what this could mean. So this is something probably which is a peak kind of an experience which a person enjoys. During Gestalt therapy, it can reach, or even in other moments of life one can reach, which in a meditation or in a spiritual union or a spiritual involvement, where again it's a contact between probably the person and something beyond. Or if you want to talk about Panchakoshas and Mahabuddhas, whether that's a contact or connection happening, or the contact being made full, at that point we don't know. I think we've not thought about it. So it is very important that we need to explore these things to find out more and more things which are there, which can be brought in, which our clients may be more familiar with. That's also very important. So these things, if you are bringing into therapy, they might be able to understand it and relate it to it, which might help them to reach their authentic self, which is the final growth or the goal of the person. So we need to know that it's not possible to step twice in the same water. I mean, with this, I would like to end my presentation here, and I would welcome questions, discussions on this.
Over to chairpersons, please.
Yeah, Parag.
Hello.
It was a nice presentation, Dr. Sam. I will hand it over to Dr. Parag for further proceedings.
Sir, it's a wonderful information that we all had. I think the real life experience sort of teaching that you provided by role modeling was something which was very interesting for all of us. Thank you, Isha, for that. And I think I'm not sure how many psychiatrists would be actually practicing Gestalt therapy, but for all the beginners, all the students of psychiatry who are attending right now this session, it would generate a lot of curiosity for them to explore the topic more and learn about it and practice in their routine settings. Sir, I would say that I feel on behalf of a lot of psychiatrists who are present here that you have generated a lot of curiosity for us to read more about it now. And with this session, I think a lot of people are going to explore this therapy much more than what they were doing today. May I request moderators to start the question answer sessions?
Thank you so much, sir.
Alim, can I post my comments so that it will be easy?
Dr. Tufan, sir.
Yeah.
If I'm allowed to log out, I have some emergency, sir.
Oh, sure, please. No problem.
Alim will do it, sir. Thank you so much.
Okay. Okay. So Dr. Sam and
No, I was
others,
just saying, right? Yeah.
am I audible clearly? So I would raise some issues 1, 2, 3, 4. My first issue is that we are all psychiatrists. We have got all jill to be aware of the different methods of treatment that is available. And there are some methods which we can incorporate in our practice. And some methods, if you have a knowledge of that, that enriches our practice and that makes us more empowered to practice. So Gestalt therapy can help a psychiatrist depending on his available time and orientation for Gestalt therapy. My question number 1. So you have to respond to this, how it is going to be useful for a practicing clinical psychiatrist or even a clinical psychologist. To the best of my knowledge, Gestalt therapy is very rarely practiced. 1. Question number 2 is that Gestalt psychology, which came into being in the late 19th century, and Gestalt became Gestalt therapy later on by Max Weller, etc. They brought Gestalt psychology, how it is different, and how the transition of structuralism to configurationalism influenced psychotherapy. Number 3, at times I think Pauls, who had been a World War I veteran, as a psychiatrist, of course, in a phase when psychiatry was underdeveloped, and his exodus to US, like many other people in that age, and his exposure to many great psychiatrists, like many great psychiatrists, how did it influence this? Third question, this concept of be in the present, how it is related to the mindfulness treatment that is what we are talking of nowadays a lot, mindfulness based cognitive therapy. This slide which you have shown, that be in present. So all this thing, how it is correlated, and the Anandamaya Kosho which you told, how it really achieves that. These are the 5 questions that should be enlightening more. And maybe I have tried to speak out my dilemmas, and I look forward to answers from you or any other enlightened participant in this group.
Thank you, Dr. Tofan. I don't know whether I'll remember all the 5 questions. First, I think you talked about the Gestalt psychology and Gestalt therapy.
So I'll start one by one, how it is relevant to practicing clinical psychiatrist or
okay, sure. Yeah. See, that is something which is which makes me feel that something which our psychiatrist trainers have sort of sidelined. Because I have been in the psychiatric department training psychiatrists, or part of training of them. And what I have noticed, as well as interns, maybe it is an advantage for me or disadvantage for me, I don't know. Because me not knowing the language, I have always depended on the psychiatric trainees to relate with the patient. So when I ask them to ask certain questions to the patient, I could see the discomfort that is coming up in the trainees. That's where I say that there there is a need for the person to work on himself before he starts helping the other people. That's true for psychologists also. It's not just a psychiatrist issue. I'm talking about the mental health professionals as such. Because a good number of people come into, not from psychiatry, but a good number of psychologists or people who want to take up this profession may have certain unfinished business or certain things, or want to know themselves better, different existential questions, or those things do come up. So those things we have, I think the trainers have to cater to that. We have done that in different settings. And I think that has helped people with whom we could identify and help them out. If you talk to Dr. Shyam Sundar, for that matter, who's retired from Wimhans and who has been working in the different setups, he would tell us, he will have lots of stories. He's a psychiatrist, not a psychologist. And there are maybe one of the things I talked about, the field that we have is 100 patients coming into our OPDs, and we have to give them medication and send them off. And it may not be possible for us to attend to that. But I think as a psychiatrist, if I am a psychiatrist, I would probably look at my own body. Am I taking care of my own body? Am I taking care of my own when I sit for consultation? How are my bodily responses? I had a couple of people who talk about, as I'm talking to other people, my anxiety comes up related to the issues that are coming up. So I think this is something which one has to be mindful of, because we want you to do a longer innings. Like I was talking about, 99-year-old still practicing. I think because our country needs experienced psychiatrists and psychologists, rather than leaving the scene saying that, okay, enough of me, I'm tired, I'm burnt out and stuff like that. So that's my first response, Dr. Patti. I think second, did I answer your question, or?
Sir, you have to unmute yourself. Tofan sir.
I learned that we can enrich ourselves to be more competent to deal with the patients. Alim, if there are questions in the box, you ask it. I shall go to my second question later.
Yeah.
Or I can ask.
Okay, sir, you can proceed.
Asha, now my second concern was that someone posted just now about Vipassana meditation, and I had mentioned about mindfulness-based treatments and mindfulness therapy. And we had a slide presenting that being present, think of the present. So is it just a modification of these treatments, or they're quite related to each other, very close to each other?
Yeah, in one sense, yes. In another sense, no. Being present is very much, being present is also important. When we are talking about, online presence, the therapist presence makes a difference. I can do mindfulness meditation on my own, but the presence of another individual makes a difference in helping out from a Gestalt therapy perspective. So if you ask me, I have a problem, I am doing my meditation, I've done this kind of a mindfulness part, and it has been helping me fine. But if I'm practicing Gestalt therapy, I am thinking of my presence, or me and the client working together, or me and the patient working together is important. And you also asked about the Gestalt psychology and the Gestalt therapy.
What I asked, Gestalt psychology founded in the late 19th century by Wertheimer, Kohler, or someone else. Okay. And we had this from other people at around third decade of the 20th century. And in this transition, particularly Pearls, he had been involved in the war. So this must have changed his definition, his concept of himself, as well as he had been seen as a follower of Dadaism in art, which is indication, right? This is indication of revolutionary spirit. So this transition, my question was, this transition from structuralism to configurationism, was it just an indication of revolutionary spirit in Pearls?
Yeah, I'll first respond to the first part of your question about the Gestalt psychology. See, it is interesting that we are talking about the perceptual Gestalt. but there is a linguistic Gestalt which was talked about 5,000 years ago, and Dr. Ramachandra Rao, whom I mentioned, has written about it. See, that's very simple. If I can I have a dialogue with you, Dr. Pati?
Yeah.
See, yeah, when I say, I just say the sound C. What comes to your mind?
Your voice.
Sorry?
Your voice, when you are telling sound to me, your voice comes.
My voice. Okay. Yeah. Okay.
If I introspect, Om comes.
Okay. When I say O, what comes to you?
Om comes.
Om comes. Okay. When I say W, what comes to you?
W, wind.
Wind. Now, I said three words, three sounds.
Yeah.
Not three words, three sounds. Can you say the three sounds together? Or three letters together?
You said about O, W. First you did not told only about sound.
No, I said C.
Yeah, C.
C, O, W.
But that C I took as SW.
No, okay. It is C, O, W.
Yeah, cow.
Cow. So now the whole meaning changes.
Yeah.
What you said earlier for three things is different now when you say it is cow. It means different meanings for different people when they hear it. So that's the simple of the Gestalt psychology coming into Gestalt therapy. But probably the Gestalt therapists, as I've said, most of them were basically psychiatrists who had taken up different path after analysis. They moved away from it because they didn't like the interpretation which the therapist does or the analyst does. So they moved away, and past is important for the Gestalt therapist, but we don't work in the past, we work in the present. So that's how we move on. Yeah. So I think the other two questions will come later. Otherwise, it will become a dialogue between you and me.
Yeah, that is.
I don't mind doing that, but we'll come back to you, Dr. Pat.
We can do that on telephone also if this session ends.
Yeah, we can conduct a Gestalt therapy training also. Yeah.
Thank you so much, sir. Thank you so much, sir. Sir, as we have learned about Gestalt, that if you talk on images, we tend to fill the gaps and complete the pattern in the images, then in sounds, then in behavior. Is it what we are talking about?
No, Dr. Alim, is it? Okay. Dr. Alim, see, we are not filling the gap. The meaning that comes out of the parts is different from what just the adding up of the parts. See, I have a part which says that you go in this direction, which another thing says that you go in that direction, but these two are not connected. So I have to make these two connect. When I connect these two, it becomes a new thing for me. So in the process that you saw, we didn't have time to go into different things which came up, which I think in the chat box also, it came up. The different directions are there, but which is making us into different parts. But we, as a Gestalt therapist, when we relate with the person or when we work with the person or when we are in the process, we try to help the person to make the contact me within myself, which makes a totally a different self. Or which we call it the authentic self. Yeah.
So, yes, sir. So please pardon my ignorance. Let me ask some silly questions. Why should Gestalt therapy help anyone? Why it should help a person?
Yeah, that's
how it
very
helps a person?
Yeah, that's very interesting thing, because that's something which we have called as the paradoxical theory of change. So I don't change, or the moment you try for change, okay, you come to a phase where to a state where you are sort of stuck. Okay, then it is not a phase for you to being stuck there. You have to move again. I don't know whether I'm making sense. It's slightly a complicated thing. So I want to. I talk about being. I come to you for therapy. Okay. With the thought that, and go on talking about different things which I don't accept for myself. So unless I accept me as I am, then only I can change. So when I accept myself, I change. But I don't stay in that change. It has to go on like that. It's a kind of a process, change process, which has to go on. So when you talk about somebody coming for Gestalt therapy, the scope for it would be the clients may not be aware of it, first of all. And you might see, for example, aphonia. People come with aphonia. Okay. How does aphonia happen? How do you explain it? Or people are coming with bodily disturbances, unexplained physical symptoms. How do you explain it? How do you help those people? We very much know that that is probably coming from some kind of a disturbance the person has. So that person has to be made aware of it, which makes the person to move and makes life different for the person. I don't know whether I've answered your question, sir. Or
Yes, sir. Yes, sir. So let me take up the question from the chat box. Suppose if there is a lot of physical discomfort, is it just acknowledged, or the client would be helped to get relief from discomfort? Here, the client had headache, for example.
I was aware of the time limitation. So the person who has observed is fine, because I was about to make the person see what has happened to the headache, but I don't know whether the person has been having some kind of a migraine even before or not. Those things have to be checked or looked at. But the person said that it's a whole body. So whether it's getting focused or this part of the head, it is stuck there or not, we don't know. So it has to be looked into, definitely, but it didn't come up again. The person didn't bring this up again. So if it was again, I've asked the person to scan through the body, and then it didn't come up. If it had come up, then probably I would have moved to focus on that and respond to that. Yeah, worked on that. Yes.
Yeah, sir. Sir, on that note, when we did this live interview, this demo session, how the things proceeded? Can you give a bird's eye view of a Gestalt view of the session that you just did?
Yeah, I need Isha's permission for that. Is it okay, Isha, for me to talk about it, or how do you feel right now? Because I don't want to take her back to where she was before, because she has come to a different phase and she want to move on. So if I need her permission if she's around.
No problem, sir. It's fine. We can carry on.
Okay. Yeah. See, the answer has to come actually from Isha, because it's something like, after eating an apple, can you tell me how does it taste? The person who ate the apple will be able to tell it better than observers. Okay. So, Isha, do you want to say anything about that?
About the apple?
No, or what you experienced? Do you want to say something about it, or?
I believe, sir, as soon as we started talking and you started asking me questions about how I'm feeling and what I'm thinking, I believe the first thing that hit my mind was definitely the thing I was stressed about, or what I was just constantly thinking about. That came to my mind at the initial time we started talking about it.
Yeah, I didn't want, because of the confidentiality part, I couldn't assure you confidentiality. So that's why I didn't want you to. I knew that it was there within your lips. It was there within your mouth. You were probably, that's why I was asking, what are you holding back? A lot of things could have been coming out, but I didn't want you to state in that to an audience where we don't have control or about the confidentiality, etc., etc. So I didn't want to do that. So that was my limitation. I was trying to sort of help contain things between us so that it doesn't go out of proportion. And I also wanted to see that it comes to a contact, at least in one of the phase of your life, to contact between your thing and the self. Did I answer your question, Dr. Halim?
Yes, sir. Yes, sir.
Yeah.
Sir,
So
question from the
there,
chat box. Yeah.
there were a lot of things that came up, and probably there is and I don't want to put it as a prophecy. There are more things to work on, unfinished business, which which has to be resolved. And if it was an in-person one, then probably we could have done if it's in a group setting, we can engage the group to get a lot of things out, or even in an individual one, if she was not prepared, I had a couple of things for the properties or certain things that can be used in working out things rather than talking about it. So that's why I was asking whether there's something which you have an object in front of you. Sometimes people are comfortable in talking to pillows. People are comfortable in talking to certain objects which can be thrown away. People burn things, and that makes a lot of relief to people in their life, and they are able to move on. It's not drama or psychodrama, some people say. It evolves, or it comes as the therapy progresses, or the meeting progresses, or the dialogue progresses. Yes.
So that means we have to have plenty of time at hand.
Yeah, at least 45 to 1 hour, if for an individual. That's true, as it would be in any psychotherapy sessions that are scheduled, 50 to 1 hour. Yes.
Okay. So the next question from the chat box. Suppose the clients are not able to recognize discomfort. How do we proceed?
Yeah. Okay. Discomfort in the body?
Probably discomfort in the body or in their thoughts and emotions. If we can take both of them.
Yeah. You are reminded me of my own training, where my trainer, I had a supervisor. I mean, I had a therapist who was helping me out, and my trainer was observing what was going on. Then immediately after the session, my trainer told my immediate kind of a therapist, "Why did you leave him like that?" Okay, so probably maybe I was not giving a lot of information, or it didn't come up to me, or I was using the defense mechanisms of retroflexion or introjection and didn't want to address the issue that was bothering me. So this that happened. So my trainer did work with me and bring this out. Okay, so it is kind of a part of training that people, even if it looks as if people are defensive or doesn't want to talk about it, sometimes we may sit quietly for some time, maybe 10 minutes, 15 minutes silence. After that, certain things emerge. But I tell that your silence is making me also upset, or I don't know what's happening. Now that your silence is sort of, that's how the relational Gestalt comes in. I reflect back. So there are different ways in which in the context, the therapist can work with the client and make the person talk. But if there is a major psychotic issue, or if you're talking about a catatonic stupor, then those are not the conditions where I would want to do. Or if it's obviously aggressive person, or who needs medication at the first sight, I wouldn't want to do Gestalt therapy at the moment. As I'm saying this, I'm becoming aware. I don't know. Way back in CMC when I was working, there was a patient with manic episode. He had a relapse, and he came here, and he was walking around with a sword. I don't know from where he got it. He was threatening all the other people. But I was the primary therapist for him. In CMC, that's a different kind of style those days, and I would be the primary therapist, and medication will be given by the psychiatrist. But as soon as he saw me, he came just like a lamb following the shepherd. So he just came like, I was also, actually within me, I had a little bit of disturbance, but I was also surprised. Maybe there is some kind of a connect or contact which makes the people calm down. So different things are possible, which, yeah, as I say that, I'm also breathing out like Ishajit. Yeah. Okay.
Yeah. Okay. So continuing from that question, which sort of personality and which symptoms and disorders are good for Gestalt?
Yeah, anxiety for that matter is quite good. or it works well with them. Not, I wouldn't say good, that I would like to take back that word good, but it works well with people with trauma, because a lot of things people linger it long. People do not recognize it. People do not want to talk about it, but it works well in bringing out a lot of unresolved things. And that has helped a lot of people to move on. Grief is another one which helps people to work better. So there are, even with children, people are working, very, very interestingly. I was talking about France, Margherita in Italy. Her institute is working with a lot of children. A lot of people are working with different kinds of populations. It's not just the patients alone. Many people think that this therapy is only for patients. We have a lot of people working in corporates, people, students, in the college population. There are a lot of people who need it. So if somebody, psychiatrist, can take a lead in having a group for this kind of people, one may be able to identify people for suffering. Maybe some of them may need medication which are going unnoticed, like in different parts of our country. I'm sure in Kerala, Dr. Enat must be aware, a lot of people into suicide, homicides, and family, different kind of things, need definitely attending to the psychological needs. So when you attend to the psychological needs, people become aware, okay, this is something which I have to address, and maybe not just Gestalt therapy alone. I may have to take medication also for this, for my immediate coping, and then probably get back to Gestalt therapy for moving on. Yeah.
Sir, from the chat box, a few similar questions. Can you give an overview of what we talk of in a person with grief, with end of life care, suppose cancer patients in terminal units, so, and past trauma? So what is the, if you can, obviously it is not a right question, but in a few words, if you can give an overview.
Yeah, so see, there are different things are there. If you talk about, people with, when you say about grief, grief related to what? Is it related relation to relationship? Not able to get over a broken relationship or a failed relationship. What is the issue there? That has to be addressed in a particular way, and how the person wants to work on. I was dealing with a person with whom I've been in touch for about 10 years now. So this person, when he initially came, she would say that you are not saying anything to me. I have been talking, but you are not giving anything to me. I'm not giving her any direction. So, and she was in her middle ages, and she had gone through a separation. I didn't push for a divorce. I didn't push her for a living together, taking all the torture, but I just being helping her out. And then there were times when there were attempts for the husband to come back, and she resisted. I didn't say that either yes or no. I wanted her to take a decision for her own that could probably make her grow. So she used to initially complain a lot of things about me, that you're not doing anything, you're all sorts of abuses. I was with her, and now the family is united. Maybe it's turning out to be a different one. So what I'm trying to say is that either it's a grief or different kinds of things, we need to allow the person to take choice, because there are different options available, and the person has to choose. And sometimes people are scared or frightened to take certain decisions. So there it might help to person become awareness and move on. I remember one girl in Lucknow, when Isha said that she is from Lucknow. I'll not divulge the information, but she attended one of the workshops, and she said that I want to sing, and my family doesn't allow me to sing. I don't know, they're not allowing me to take myself as a career. There may be other issues also, not just the singing alone. But then I said, what is preventing you from singing? She gave a beautiful song, and all the group members were very happy about it. And she was also that changed her life. And she had taken up music also. Probably if I give more information, Nisha might, since I said the location, it might be a problem. So things which makes people stuck with the fixed Gestalt, if you are able to unwind it and make the person choose or move the way the person can move or has the strength to move. People have strength. feel that, these are weak people, but they have enough strength to move on. Facilitate them, help them to move and take the decisions on their own. Yeah. I think I've slightly moved away from the grief question.
Yeah, sir, what is happening from grief? The perspective is changing to everything else, including the grief. Are we diluting the trauma that the person might be feeling? Is it what is happening in therapy?
No, not that. See, grief is something which, again, in one of the workshops, I would say the person was not able to say goodbye to the person's mother. So he was not present and couldn't be part of the rituals. There are people who are not allowed to be part of the rituals because of the family issues, which I talked about the Indian field. So there are a lot of things that can happen, and the person is not able to appropriately get over that kind of a grief. So we can't just making the person talk about it may not work. So maybe an opportunity is given for the said person to do the rituals, or sometimes say goodbye if the person has not been able to say goodbye. And I don't know, by talking about it may not help. I think there are different ways of doing it. Basically coming into terms with the loss is the important one, which can be done by direct experiencing rather than talking about it.
Okay, sir.
Is
it similar to the Vipassana meditation in which focus is on body sensations? A question from chat box.
Yeah. That I think we talked about the meditation. I think when Dr. Patti talked about the meditation part, I think I touched upon it. I saw that, so that's why I didn't want to respond to that. As I said, different somatoform therapies are there, body-oriented therapies are there. All those might be taking these things into consideration, and Gestaltians wouldn't be wanting to keep certain things aside either. If something is helpful for the person and it is in philosophy with if they are related to the present, related to what is happening at the person currently, then we would probably take it in.
So many people are asking for any research papers or good books to read about the therapy.
Yeah, I think I'm slightly what do you call as
if you can give us the link, we'll post it on our Facebook page where the recording is there.
I can give you. So actually, there's one book, Gestalt Therapy: History, Theory, and Practice, by Ansel Wolf and Sarah M. Thomas. That book has got several chapters written by different people, including the people I have mentioned, and that has got a list of resource books which are available. Online resources are also available, so I can share with you for sure.
Sure, sir. Interesting question. Yeah. Our anxiety will put the focus on ourselves rather than the client completely. So, what is your experience regarding this?
Can you just see that question?
I'll just repost it.
Can you just repeat
our anxiety?
Yeah.
I'll just posted it again. Our anxiety will put focus on ourselves instead of the client. So how does it affect the therapy?
See, this is something which is interestingly, people are talking about the co-creation. My anxiety and your anxiety together brings a different thing. It's not 1 + 1, 2 anxiety. It is a different kind of a experience that we'll come to. It will be sort of, I may not be being congruous when I say that I'm not being anxious, because it might be the clients are much better than me. So if the client is saying, there are moments where clients would say that you look very tired. And in fact, one of the training programs, they said, you look very tired. They said, oh, I was very happy that they're noticing my changes. They're able to see what is obvious and then understand what is the invisible. They saw me looking tired, that is the visible, and they're trying to make me aware that I look tired. Then I realized that yes, I didn't have lunch on that day, and it was not the proper lunch. I did have some thinking that would help me through, but the clients or the group had identified that observed that and said that, okay, you are not taking care of yourself. So that makes me to sort of move and take the appropriate kind of a change in me. So next time I may not starve and take a session. I would probably take myself fully and be there. Anxiety also can be part of it. Sometimes it can happen that, in fact, one of the moments of grief, I've not overcome my own grief. Then when I work with the grief of another person, that can come into picture, or that can come into the awareness, which can get manifested whether I want it or not. Maybe the defenses are not there at that moment, but it comes out. That's quite possible. So I need to take care of myself. I may have to search my therapist and work with that and get over it so that I don't do any harm for the clients. But sometimes it is, I do tell that your presence is sort of, you're not moving is also making me uncomfortable. So if I'm able to connect with me, then I can be myself. So we work at a different kind of a level. Yeah.
Thank you so much, sir. We have approached our time limit.
Okay,
There are a lot of congratulatory messages in the chat box. Any take home things that you'd like to tell us? And
I have a last query, Alim.
Yeah,
I had many queries. One last one.
Okay. Then I did a good job. Then I would say thank you, Dr. Pati.
My last query is
Yeah.
achieving ananda through Gestalt therapy. That has been the caption in our talk today.
Yeah.
I think we need a realistic expression, elaboration of that. What it would really be if we are successful in implementing Gestalt therapy or Gestalt in order to advance us, potentiate us. Is it the ananda bliss we tell that we get after meditation? Is it the bliss that we get out of spiritualism? What is that we mean by ananda by Gestalt therapy? That has been our caption today.
Yeah, it's not Ananda Maya Gestalt therapy. It is Ananda in Gestalt therapy. Okay, so in fact, I have discussions with several of my colleagues who work in the Indian concept. So this is something which I thought, when you have a final contact, the final contact is described as, suppose if I feel thirsty, okay, that's a bodily sensation that comes up. Then I move and then I take water, and then when it comes to the lips and take the final contact, I have a kind of a different kind of a sensation that I have. That sensation is quenched, and I have a different kind of experience at that time. This kind of final contact can happen in different moments of our life, including probably if you're thinking of a sexual intercourse or union, then the final contact is something which is joyous, which probably Fritz would say is the moment of joy, etc., etc. So it need not be seen on face as a smile. That's what I was trying to show you, the Ramakrishna's picture. You can't say that he's not experiencing ananda. He has an experience of ananda, but it's felt in a different way. So it's kind of, ananda is for people of different people. It is of different nature. But the important thing is whether there are degrees of ananda or not. That is something which we need to look into. If you look at the Taittiriya Upanishads for ananda, they talk about only the Brahman, the Atman and the Brahman coming together. That is seen as the final contact where the bliss comes. But also possible, because those days there were not psychology or mental health was not advanced, so probably they have not tried to interpret things from a psychological perspective. So I think that onus is on us for us to understand what the ananda would mean, whether it can be stage by stage can be seen, or it is only one kind of an ananda, which is probably debatable. Is it ullasa which we have, or which is harsha which we get through the moment of enchantment, as Erwin would say that it's enchantment in Gestalt therapy. So whether we have to learn the word as enchantment and understand as bliss, or whether we understand ananda as being anandam in Malayalam or in Tamil or in other languages, might be that there may be a different word which might explain what I really experience. Which, if you try to put it in an English word, it might be difficult. Like if I say it is bliss, bliss is different. If it is ananda, it means something different for me. If it is just sandosha, or I don't know whether that's a Hindi word for it. But so there are kind of different kinds of things could be there. But my idea is that let's explore. There could be different concepts which is not there in the English literature, which might help us to know what am I really experiencing right now at this moment.
Okay, thank you, sir. I think we should now hand over to chairpersons, Dr. Ramanan sir and Dr. Parag Shah, for their concluding remarks.
Thank you, Dr. Sam, for the excellent presentation on Gestalt therapy, because most of us, I don't think will have gone through the Gestalt therapy at any point of time, because I have seen Gestalt therapy book, but I have kept it aside because I found it a little difficult to go through the entire thing, and probably now practice don't do it so often as you do. Anyway, it is probably a good beginning for us to look into such therapies and put into practice. Anyway, thanks for the nice presentation, and I thank the Odisha chapter of IPS for asking me to chair this particular session. Thank you. Over to Parag.
Yeah, thank you, sir. First of all, let me thank the organizers, Dr. Tofan Patti, Dr. Amrit Bhattajoshi, and Dr. Alin Saddiqui for the wonderful session that we had today, and a wonderful speaker for us to learn so many new things. I think for all of us, it has been a very thought-provoking, and a lot of curiosity has been generated, and I think certain things we never try to explore because we never think about it. And this session, I think, has broken the ice that we now start thinking about so many different therapies and areas in psychiatry and psychology that are still unexplored, even by senior psychiatrists that practicing for last many years. So there is a lot more to learn in psychiatry and psychology for all of us. And thank you, sir, for making us aware about it. We grasp the essentials of the Gestalt therapy today through your sessions. And the role model, the example was convincing enough for us to kind of create an impression about what it is. And thank you for sparing your valuable time with all of us and contributing to IPS activities or the Thursday music activities that we had today. Thank you. Over to the moderators.
Thank you, sir. Thank you, sir. Tofan sir, conclude the session, please.
Yes, I shall give the vote of thanks.
I would like to say thanks to the moderators, all the moderators, and Dr. Patti for it, and also for the wonderful audience, and also to Isha for volunteering. I mean, if that had not been there, this session would have been totally different, or I'll be just talking about the experiences, and it may not have made much of a significance. So I think thanks to Isha, and also to Dr. Alim for finding out at the last minute somebody who would like to volunteer. Thank you, Dr. Patti.
Thank you very much. On behalf of Indian Psychiatric Odisha State Bench, I sincerely thank Dr. Shyam Manikam for his erudite lecture. And I am obliged to our chairpersons, Dr. Ramanan Erat, who is a very dear friend of mine since long. Thanks for accepting a single request. And Dr. Parag Shah, who is very vibrant, seen in many spheres, for sparing time to be with us. And our moderators, vibrant always, Dr. Alim Siddiqui and Amrit in absence. I thank you very sincerely. I must thank Isha Rastogi for her kind involvement in this program, which has enlightened this program and given us a practical essence of what it could be. And moreover, I am obliged to the 400 plus people who had registered for this, and we had above 200 attendants on many occasions. And I thank everyone because all of them had come in spite of the festive tempo all over, even in the lane beside where I'm staying, there is festival. It was there till 8 p.m. And I appreciate the enthusiasm. I thank the team of Terrain, which is supporting us always. And I thank Areem and Amrit for their constant contribution and constant moderating and being always the main anchor between the audience and the speaker. And I'm thankful to Dr. Manikam again for invoking a lot of interest and inquisitiveness in all of us, which inspires us to think that we'll be having another session after discussion in which we solicit that there must be more practical demonstration. It could be a same demonstration, but it must be more expressive, where everybody will know what happens. And we hope all of us will have the ananda, the bliss, whatever you may name it.
And so thanks to you also for allowing us to do whatever we want.
And many happy returns for all the festivities that is going on and that is to come. Thank you. Good night.
Okay.
Thank you. Thank you.
Thank you, everyone. Thank you, everyone.
Yeah. Okay. Bye-bye. Bye.
Bye.
Bye-bye. Superat.
Pavan?
So, can we close the session now?
Yeah.
Close the session. Thank you, Sam, sir.
Yeah. Bye.
Thank you, Isa. Thank you, Manikam.
Yeah. Bye-bye. All right. Bye. Bye.
Alim, so nice. Pavan?
Yes, sir.
हम क्लोज कर सकते हैं.
Okay, okay.